We earlier on discussed gestational diabetes mellitus. So we said is a condition where glucose levels in pregnancies are shooting up. So glucose levels could shoot up because maybe insulin, there's no insulin. That's insulin deficiency. Glucose levels can also shoot up if, yes, there's insulin, but the cells are resisting insulin. All right. So some of this insulin resistance can shoot up in pregnancy. So we just want to link insulin resistance to pregnancy. All right. What's their link? Okay. How can it possibly occur? So what we have is, first of all, you should know that it's a physiological adaptation. So usually ensures that the growing fetus receive what? Adequate glucose. Do you understand? So the body is resisting insulin because the baby needs glucose. So however, when this resistance becomes for too long and is compounded by maybe the mother has some small underlying issues with what? Glucose processing, it can lead to complications like what? The mother having high glucose levels. That's gestational diabetes mellitus. All right. So this can now have effect on the baby and also have effect on the mother, we should be looking at. So what causes it most of the times is placental hormones. All right. Human coronary gonadotropin hormones. They usually interfere with what? How insulin is being what? Sent into the system and responded to. So insulin is being sent, but the cells are not responding. Right. Sometimes increased maternal fat. All right. Most women, they become obese during pregnancy. They become fat. Sometimes it's genetic issues. Okay. So physiological changes. Decrease in insulin sensitivity will lead to what? Decrease in glucose breakdown. This is leading to what? Gestational diabetes mellitus. All right. But the body is trying to what? Counteract. Do you understand? Compensatory mechanism. So the body is trying to produce more insulin. Why is the body not just trying to produce more insulin? All right. So because the body can't use insulin to break down glucose for itself, the body now opts into breaking down lipids, okay, and free fatty acid for energy. Now this could cause ketone levels in the body to be so high. The placental glucose transporters is increased. Okay, so risks and complications on the mother side: gestational diabetes, preeclampsia, cesarean delivery, because the baby can become so big, macrosomia, so the baby can't go through vaginal delivery again. Postpartum metabolic syndrome. All right, on the baby is large, all right, glucose levels are low, all right. Obesity, the baby can develop diabetes, altered fetal programming. So these are the management. Healthy diet, your diet that time should be low in sugars, right? Physical activity, please, keep doing exercise. Then you continue monitoring, then you give some medications that can basically help with that.